Thanks for tuning in. We're back here with Chad Jackovich, CEO and founder of Pure Benefits of Michigan. Welcome, Chad.
Hey, hi.
Did I butcher your last name? Is it Jackovich?
Jackovich.
Jackovich, sorry.
Thanks for having me, Janelle.
Well, thanks for joining us. We're really excited to have you on our show today to talk about something that's a little unique and a little different as we look at healthcare benefits and healthcare versus health insurance, right?
Sure.
So before we get started, Chad, I'd love it if you could just take a brief minute to introduce yourself to our listeners and share a little bit about your background.
Sure, yeah. So we manage and administer employer health benefit plans, and that's really the whole reason why we got started in 2015 was costs were getting out of control. People still today intermingle those two words that you just mentioned, health insurance and healthcare, and we try to deliver the messaging to make sure people understand which is both, and certainly trying to deliver high-performance health plans that really save employers money, anywhere from 10 to 50% usually, and also give them the opportunity to reinvest back in their health plan, giving them more options instead of pushing them back in a corner where they have to make difficult decisions each year.
Absolutely. So how long have you been in this industry?
Got started with health benefits in 2013.
Okay.
Certainly worked in a pharmacy for almost 5 years before that, so that does go along with the health benefits, the pharmacy benefits, and the medical.
Mm-hmm.
And then before that, I previously had a 2-year program in nursing where I was the only male.
Oh, all right.
That's a little fun fact.
That is
thing that most people probably don't know about me.
I love those fun facts because it makes you a little bit more memorable. You know,
Yeah.
people always tend to remember that fun fact about you. So, too cool. Thanks for sharing.
Yeah, of course.
Well, I want to jump in a little bit here because you mentioned that one of the things you focus on is really working to save employers some money and what they're paying in healthcare premiums. So we were recently discussing the topic around healthcare regarding community-owned health plans. Can you tell our listeners what is a community-owned health plan?
Yes, so we're starting to see this happen across the country, really, and it's happened in smaller pockets. So healthcare is local, and that's where it needs to start. And so we're starting to develop these community-owned health plans that are really owned by the community. Important note that they're not owned by the health insurance carriers. We're building them out, and it's really to pair employer groups and employees who are the purchasers of healthcare with healthcare providers, and your healthcare providers are your doctors, your nurses, the pharmacists, and that's where we intermingle health insurance and healthcare. And so how we help them is we're setting up the plans to architect the health plan, to administer the health plan, and bringing these two together. And basically, it's the right partners that are aligned with the interest of the employers and the employees to deliver that high quality care at a low cost, which you're not finding typically in the traditional health setting.
No, and I know that you mentioned a little bit about healthcare and health insurance. Can you explain the difference between those for our listeners?
Sure. So if we talk about, if I was to ask a CEO or a CFO or even maybe some HR directors and HR managers, who is your healthcare provider? They would answer and reply usually with, Blue Cross or Priority or HAP, Cigna, Aetna. One of those would be your typical response. Your healthcare providers are actually, like I said just a moment ago, your doctors, your nurses, your pharmacists. The health insurance carriers literally provide no health care. Now, they do administer and pay your claims, so they're a claims processor is what they are. Okay. That's the big difference.
Thanks for the clarification there. So what are the benefits of a community-owned health plan?
Okay, so anything from just sustaining the healthcare costs in the plan that usually gets passed on to the employer and employee through rate renewal increases each year that happen annually upon renewal time, to delivering high-performing health plans. And I want you to imagine your health benefits having $0 deductibles in them. So you don't owe a huge deductible before your plan really kicks in and starts to pay for itself. So a $0 deductible versus what you may have in your own plan today, which is we're seeing anywhere from $1,000 to $5,000 that most individuals are on the hook for, that have to pay that amount before their plan again kicks in. Then you also have the co-pays and co-insurance. We're zeroing those out as well. We don't like co-insurance, so why not just put a 0 there? Co-pays, I won't say that we have 0 co-pays in, across all the plan, but we try to put $0 co-pays in where we can. And so we're also lowering the out-of-pocket maximums to which it would be closer to what you would feel like your deductible would be. So you don't have that financial burden to delay care if you actually need it. That is one of the things that happens when people have a high deductible health plan. They won't go in and get the care they need. So what do? They push it off, they delay it, and then it usually ends up being an ER visit, more costly to the employer, more costly to them when they do have to go in for that treatment or procedure. And so we find that better benefits actually does reduce cost. It's not the opposite.
And therefore even saving the employer more money.
Absolutely.
Okay.
Certainly.
So, this almost sounds a little bit too good to be true, right? So,
well, and when you have these aligned partners working for you, the employer now gets to decide, how do we reinvest back in the plan? And you think about that for a moment. They've usually been getting what's delivered to them is hey, your costs are going up this year and your benefits are getting worse, because they have to offset those premium increases somehow. So are they eating it, or are they passing that along to the employees to eat, or do they just increase and worsen the health benefit plan? And so we're actually delivering the opposite. We want people to know that you can increase your health benefits, make smarter purchasing decisions, okay? Take control back of your healthcare spend by getting yourself more plugged into the conversation.
So what are other hurdles or challenges with a community-owned health plan? Because all of this sounds really great.
Sure. Well, there is a process.
Okay.
I don't know if they're hurdles or challenges, but I would say for the most part, it starts with anything. Starts with good communication and also education within the health plan and how it's going to work for the employer groups. I think if you don't have the participation with leaders in the community, that's going to be difficult to set something like that up. So you definitely have to have the engagement of education and communication up front, but participation is key. And then it's really a mind shift change with the status quo. So in how you're delivering health benefits today to your employees with the traditional health plan, to a more high-performing health plan that would actually give you the opportunity to reinvest in how they get their benefits and pay. Even we see that people that reinvest back into their health plan can look at the two buckets and how they compensate their employees. It's either through maybe how they pay them or their health benefits, and they can maybe give them a pay raise that they haven't had in a while, or they can give them richer benefits in their benefit package that they're delivering to the health the employees in their health plan. But we use an acronym called LOCAL in changing that mind shift for community-owned health plans. And the acronym LOCAL, the L stands for learning. It's learning how to liberate from the status quo, and you have to pivot. And a lot of employers understand this because in the last year they had to pivot from the pandemic. I can't think of a more difficult situation than what they faced last year in 2020 throughout this year in 2021 thus far, with having to pivot, people working from home. How's all that going to work? And so this is nothing more than a pivot with how you deliver healthcare. The O in local is for optimize the plan infrastructure. That's making the benefits better. That's setting your contracts up correctly. That's setting up the plan documents, how they need to be changed or modified, that really align with the employer and the employees. The C for local is to carve out the PBM. That's really the low-hanging fruit in the health plan, where you can save a lot of money just by aligning yourself with the right partner. And then the A for local is add value-based primary care. That's very substantial because they're really the first person to see you before you get into the health system and you start getting care. And then L, the last L for local, is leave behind the value extracting PPOs and HMO networks. That's where you have more freedom to lower cost and do more contracting and get yourself in on those conversations.
Awesome. I like that acronym. I love acronyms. So that's
helps.
a great way to break it down.
Yeah.
Who is this plan for, and why is it necessary?
So it's for both private and public employers.
Okay.
They both can use it. Large employers and small employers shouldn't be just available to just some organizations. Everyone should have access to high quality, low cost health plans. And I want to note that this is just bigger than any one employer, okay? So this is really getting an employer that thinks of themselves as a leader in Howell or Livingston County that can really help be the anchor in the community to develop such a plan to where it's really going to benefit not only them and their organization and their employees, but it's going to help others within the community as well. So some say healthcare is expensive. Okay, healthcare isn't expensive. What's expensive is profiteering and the price gouging that's going on in healthcare. And if you can steer clear and work with aligned partners, you're going to be able to deliver better plans.
So who should get involved in a plan like this?
So from the community standpoint, we wish for local leaders to get involved. We think of themselves as actually leaders, and so that's anything from local chambers to city managers, the city mayor, could be Livingston County board, large employers, CEOs, CFOs, and HR managers that all contribute to the decision-making process with their health benefits.
Okay, and what kind of savings is involved with a community health plan?
So we're seeing you can save anywhere from 10 to 50% in plans like this. Okay, we're doing it every year. That was half the reason why we founded Pure Benefits of Michigan back in 2015, is because of the cost and the quality and really the medical management and the PBM costs that we needed to address. But 10 to 50% on your overall healthcare spend is.
And that's 10 to 50.
10 to 50.
Yes. Not 15.
no, 10 to 50%,
Perfect.
which year after year, that certainly starts to add up, and then you can think about where would you put these healthcare dollars instead? Would you reinvest
Absolutely.
back in the company? So.
Well, Chad, I want to wrap up here, but I want to also give you an opportunity to share your contact information for those interested in learning more and what the next steps would be.
Yes, so you can contact our office at 517-200-7873. Email us at info@purebenefitsofmichigan.com. Go to our website and contact us through our website. That's fine. purebenefitsofmichigan.com. And also look out and listen for announcements that are going to be coming out soon regarding the community-owned health plans and how you can participate in one of those meetings.
Awesome. Thanks, Chad. We really appreciate the information today. And again, anybody interested in joining onto the community-owned health plan, contact Chad.
Thank you.